Hi, I'm Sarah, and I suffer from panic disorder, a chronic condition in which I have sudden and prolonged attacks of fear, or a panic attack. The last time I sat outside to write, my heart began to race, and I felt like I could not breathe. It was when I felt numb and could not walk for chest pains that I knew I was having a panic attack. My doctor said it is likely I have an overly sensitive respiratory control center in my brainstem, as new research has shown that even minor changes in oxygen intake can provoke a feeling of suffocation, leading to a panic attack. She prescribed me Zoloft, although she said Prozac and Paxil would be fine too. I recently read that these antidepressant drugs increase levels of serotonin at the synapses, effectively controlling my attacks. Said serotonin mimics an inhibitory neurotransmitter in the respiratory control centers of the brain, reducing neurological activity and sensitivity. Even though I have this disorder, I will do everything in my power to lead a normal life, and I will not let it control me.
My name is Brianna Mitchum, and I have social anxiety disorder. I was diagnosed with SAD when I was 13. Although this is the most common of anxiety disorders, it also leads to higher rates of substance abuse in young adults like me. People with anxiety disorder are usually shy around new people, quiet around groups, and withdraw during opportunities for social interaction. Sometimes when I meet new people, I have peaks in fear, and my heart races. Sometimes I sweat or tremble. Most adolescents with SAD have low self-esteem and high self-criticism. My doctor prescribed me with fluoxetine. It's the generic form of Prozac. It's a selective serotonin reuptake inhibitor, increasing the amounts of serotonin in my brain. Since taking it, I've stopped having as frequent panicky thoughts. Most people don't seek treatment with this disorder. My name is Rosalind Cobb, and I have tetraphobia, the fear of monsters. Phobias are irrational and excessive fear of an object or situation. More than 10 million people in the United States suffer from this disorder. In most cases, the phobia involves a sense of endangerment or fear of harm. I was first diagnosed with tetraphobia when I was 7 years old. I was out trick-or-treating when I quickly became very dizzy. I lost my breath, and I felt as though I was going to puke. These sensations got to the point where I would have full-blown panic attacks if anyone even mentioned monsters. I don't know what I would have done were it not for Dr. Wright. She prescribed me alprazolam, the generic form of Xanax, to calm me down. It's a benzodiazepine, which works by decreasing abnormal excitement in the brain. Researchers performed an MRI scan on my brain and think there may be something wrong with my amygdala, causing the intense fear.
Hi, I'm Alice, one of 6.8 million Americans who suffer from generalized anxiety disorder. My disorder results from a process of maladaptive and habitual interactions amongst cognitive, behavioral, and physiological response systems. When confronted with certain situations that evoke fear or anxiety, such as a test, my thoughts become simply irrational. My doctor told me that GAD is caused by an excess of neurological activity in the amygdala. She said this leads to increased emotional arousal. Excessive neurological activity stems from malfunctioning inhibitory neurotransmitters.
My name is Soraya, and I have been recently diagnosed with OCD. Obsessive-compulsive disorder is an anxiety disorder in which people have unwanted and repeated thoughts. Since I was 14, I have had an issue with making sure everything is completely organized. I have to bring all my cleaning supplies, so when I have to go to the restroom, if I don't have my cleaning products, I will refuse to go all day. My parents have asked me to explain why I do it. I feel like if I don't do it, something bad will happen to me. My psychiatrist, Dr. Wright, prescribes me a type of antidepressant called Prozac. Prozac stimulates the growth of new neurons in the brain's hippocampus. Obsessive-compulsive disorder derives from an underlying core fear. My doctor would expose me to fear-producing stimuli. I really hope that by continuing my therapy and medications, this disorder will disappear from my life. Hi, my name is Jasmine Garcia, and I was diagnosed with PTSD. It can occur after you've seen or experienced a traumatic event that involved the threat of injury or death. There are many symptoms of PTSD, such as feeling detached, difficulty concentrating, dizziness, having trouble falling asleep, and having outbursts of anger. My doctor decided to do a form of treatment called desensitization. When I was 14 years old, I was raped and abused. This event in my life has traumatized me. Every day I walk home, I'm terrified of people following me or watching me. I feel like I don't like to be touched because when I was raped, he took control of me. I've been seeing a doctor by the name of Dr. Wright, and she has been providing me with medications to help me with depression. She's also referred me to a psychologist as well to talk with. I honestly feel like this disorder is taking over my whole entire life, and I don't know how to cope with it.